Hi, it's Naresh the Orthodontist here, and today I'm going to cover the concerning increase in trends to direct-to-consumer retainers. What is a direct-to-consumer retainer? These are retainers that you can order directly from a company, usually generated via two methods: an at-home impression technique of your teeth, or more commonly now, the use of previously undertaken orthodontic scans from your dentist or orthodontist. The retainers are made without a face-to-face clinical examination by an orthodontist at the time of ordering, and in some cases they are made via a GDC-registered dental technician, providing some illusion of reassurance. The type of retainers are almost exclusively clear plastic Essex-type retainers. My advice to all patients remains that direct-to-consumer retainers should be avoided. The perceived advantages are low cost, typically much cheaper than orthodontic supplied retainers, but reviewing some of the company's prices, I would question this. If you need regularly replaced retainers, this is an attractive option, but if you do, then I would ask, have you actually got the correct retainer in the first place? Convenience, no need for appointments, delivered to the comfort of your home. Very useful if you've lost contact with your orthodontist and now live off-grid. Speed, often quicker than an in-surgery made retainer, may be an option for emergency replacement when a retainer is lost or broken. And acceptable for simple maintenance, claiming to work reasonably well if your teeth are stable, your bite hasn't changed, you've worn retainers consistently and well, and you're replacing like-for-like retainers. But I would ask, how many patients really know if these factors apply? But from the widespread advertising and practice incentives, the parts it doesn't tell you is, firstly, you need a clinical assessment. Not having one is the most significant risk. When you come and visit your orthodontist, we are trained to review and check for tooth movement. Some of these may not be obvious to you. Looking around your gums for disease, and these may be affected if you choose the wrong type of retainer. Changes to your bite, suitability for the type of retainer. In essence, the wrong type or design of retainer often creates a problem you previously didn't have, or worsen problems that are quietly grumbling away in the background. Getting the right impression. The training and discipline required to take good impressions takes effort and skill. Compound this with trying to do it for yourself adds another level of uncertainty. This is why dentists see other dentists for their own treatment. Poor impressions only result in poor fitting retainers, which then lead to unwanted tooth movement, increased risk of tooth root damage, pain, gum damage, and premature cracking and warping of retainers. With this system of direct-to-consumer retainers, there is no or little accountability, limited to no clinical responsibility, limited warranties, and harder to resolve issues when things go wrong. Direct-to-consumer retainers are not ideal for most cases, but must be avoided in more complex cases, and I would particularly caution patients who have fixed or bonded retainers, have any history of significant bite correction, have previous or ongoing jaw joint issues, history of gum or periodontal disease, and when there has been an ongoing issue with orthodontic relapse. Where direct-to-consumer retainers can sometimes make sense is as a temporary replacement retainer for a few months before you get to your orthodontist, but unless you live on a desert, you should always find an orthodontist. The General Dental Council, who has a regulatory role and exists to primarily protect the patient's safety, also has some views on direct-to-consumer retainers in orthodontics. They say that there is no effective substitute for a physical clinical examination as the foundation for oral health assessment before treatment. The treating dentist or orthodontist is personally responsible for ensuring the standard of the dental care team. But when you have a direct-to-consumer retainer, there is no such clinician or team. For consent to be valid, there must be a direct interaction between the patient and the practitioner, and so the patient is able to ask questions and understand fully the risks. The patient must know the dental professional responsible for their care and be able to contact them directly. The placement of retainers and removal appliances can only be performed if a clear prescription is provided by the supervising clinician. The bottom line, direct-to-consumer orthodontic retainers may be perceived as a convenience product, but it is not a good clinical substitute. They can be reasonable for a short-term maintenance, but they carry higher risks than orthodontic supervised care. I hope you found this short video helpful and informative, and I thank you for watching.